welcome to another episode of the Prescription for Better Living podcast. I'm Dr. Hernando Carter, board certified internal medicine physician, your primary care extraordinaire. We're happy to see you again. If this is your first time in the PBL podcast, welcome. If you are a returning PBL podcast listener and or viewer, thank you, thank you, thank you. Either way, you know what I need you to do. I need you to subscribe to our podcast. I need you to like, share, and comment on our podcast. I need you to spread the good news everywhere you go. If this podcast has blessed you in some way, helped you in some way, taught you something new, we would love your support. And there are many ways you can support us. You can hit us up on the Cash App, $PBL podcast. No amount is too large or too small. You can become a member of our community on Patreon, just $1 a month. Subscribe at patreon.com/Dr. Hernando Carter. Also, you can become a podcast sponsor. We would love to have you become a sponsor, so you can email us at contact@rxforbetterliving.org, contact@rx4betterliving.org, and we'd be happy to talk to you. Speaking of sponsors, shout out to my man, Cedric Cooper, and Right on Time Physical Therapy. Look, everybody needs a physical therapist, whether you're having some joint soreness or stiffness, whether you're having some muscle tightness, you need somebody to help you develop a workout routine, holler at my man Cedric at Right on Time Physical Therapy. They'll take care of you. RightOnTimePT.com is the website. Also, you can visit them. They're right over there off Avenue D in Inslee at the Inslee Health Club at 2000 Avenue D, or you can call them at 205-209-8771. Also, shout out to our sponsor, Bespoke Wellness, full service wellness clinic, can take care of your weight loss needs, can take care of your IV fluid needs, and can take care of your concierge primary care needs. If you're interested in learning more or getting set up with Bespoke Wellness Services, you can give them a call at 205-396-2820, or you can email care@bespokewellnessservices.com. You can also visit drhernandocarter.com and book a free consultation with Bespoke Wellness Services. Also, shout out to drhernandocarter.com, our sponsor. We got the podcast merch for you. Go and check it out, drhernandocarter.com. Click on shop, and it'll take you to the online store. Look, we are transitioning out of hoodie season, and we are transitioning into t-shirt season. And very soon, we got the podcast t-shirt merchandise heading your way. So be on the lookout for that soon. Well, this is episode 41. And this is a continuation of what we started talking about with my pleasure. My pleasure is really taking a look at how do we apply good foundational customer service principles to healthcare. How do we make good customer service translatable to the medical industrial complex? And we started out by doing a case study looking at the Heavenly Chicken Place. And Gary knows that I love that Heavenly Chicken Place. I love it. I probably had it, Gary, at least a couple times this week already. Heavenly Chicken Place. I mean, they got you for the breakfast. They got you for lunch. They even got you for dinner. Heavenly Chicken Place. But we talked about just the consistency in the experience. No matter where you go, no matter what state you travel to, no matter what side of town you're on, 95% of the time, you're going to have a consistently pleasant, professional service. If you order a milkshake, 9 times out of 10, you're going to get a John Brown milkshake. And you don't have to hear, ice cream machine broke. Ain't no ice cream tonight. We've all been through that. No, we're going to have pleasant experiences, and we want to apply those principles to the medical industrial complex. Well, why do we want to do that, Hernando? I'm glad you asked. Remember, we said a lot of people don't like going to the doctor to get their annual checkups. They don't like going to the dentist twice a year to get their teeth cleaned. They don't like engaging with the medical industrial complex. And a lot of the times it's because in the past they have had bad experiences, i.e., they've had poor customer service. We talked about how unpleasant sometimes going to the doctor can be, with the long wait times, with sometimes the unpleasant disposition of the people in the practice, the fear of the unknown, all of those things, right? And again, if the goal of this podcast is to promote health and wellness in our community, then we have to work on making the experience at the doctor's office a more pleasant experience so that you'll want to go. If we're going to reduce health disparities and promote health equity, as a doctor, I understand and know that we got to get you to go to the doctor. We got to get it to where all of our listeners and our viewers and everyone in their circle that they care about, family, friends, coworkers, all understand that they all need to have a primary care provider, and they all need to go for regular checkups, and they all should be able to trust their primary care provider, that they all should be able to have a conversation with their primary care provider so that they can get the information that they need. And the only way we're going to do that is by making sure that we eliminate barriers to care. So we did the diagnosis in episode 40. And this is episode 41, the prescription. Why do you call it the prescription, Hernando? I'm glad you asked. When you go to the doctor and you're having symptoms in your body, you go to the doctor so that he can help you, A, figure out what the problem is. That's the diagnosis. And then B, can help you come to a solution, the treatment. That is the prescription. So let's revisit what we said the diagnosis was. And there were multiple diagnoses. We said that individuals receive poor customer service at the doctor's office when they engage with the medical industrial complex for several reasons. Number one, we have an overwhelmed healthcare system. And yes, we do have an overwhelmed healthcare system. There is a doctor shortage in the healthcare system. There are more patients than there are providers to take care of them. The system is overwhelmed. There's a shortage of pretty much any type of occupation you can think of in the medical industrial complex. Doctors, nurses, pharmacists, medical assistants, patient care technicians, certified nursing assistants. And once you get into the medical specialties, there's a shortage across the board. It is so hard In Birmingham, Alabama, to find a primary care provider. It's hard to find an endocrinologist, which is a diabetes and hormone specialist, a metabolism specialist. Oh my goodness. It's hard to find a rheumatologist. That's somebody who specializes in taking care of arthritis. Very hard to find one of those. And with everything that we face with the mental health crisis in this country, finding mental health providers is very hard. There's a shortage. So, because of this shortage, there is a supply and demand problem, and there's a mismatch. And so, hospitals and healthcare facilities, doctor offices are overwhelmed. Here's another diagnosis, and it's a problem. This is going to be maybe controversial, I don't know, but it's called fee for service. And we talked about fee for service many episodes ago when we talked about Medicare, Medicaid, and really how the insurance system works, how our healthcare system works. And we broke down the different types of healthcare systems that exist around the globe. And pretty much what fee for service says is that anytime you're seen by a healthcare provider, that healthcare provider submits a charge either to you or your insurance, but most commonly they submit a charge to your insurance and they are paid for that charge, right? And they get paid for seeing you, for doing stuff to you. There's no connection to outcomes. So you could start the year off sick with uncontrolled blood pressure, high blood sugar, and you can see your doctor 3, 4, 5, 6 or more times. And each time you see the doctor, that doctor's going to get paid. You can end the year off still in just as bad a shape as you were. That's fee for service. I'm going to tell you why I'm saying that fee for service is part of the problem. Because fee for service incentivizes volume. So the more patients you see per day, the more money you make. So it's very simple arithmetic. If you could comfortably see 10 to 14 patients per day and spend 30 to 45 minutes, sometimes more per patient, and really get into working on their health issues. And if you could do that and make the same amount of money as you would if you were seeing 30 or 40 or 50 patients, what do you think the healthcare provider would rather do? They would rather see the 10 to 14 patients and take their time, spending time with their patient, answering all the questions, going over all of the results, explaining all the medications, what they're used for, side effects to watch out for, right? Have more time talking about positive lifestyle changes you can make, doing more counseling and education. But that's not how the fee for service system is set up. Again, the fee for service system is set up so that you get paid per each patient you see per day. So remember we said, and this was another diagnosis, but we talked about tight margins. We talked about how the cost of doing business has continued to climb over the years, where rent is more, lights cost more, Water, Lord have mercy. Birmingham water. Who anybody got Birmingham water? Water costs more. Supplies, paper costs more. Ink, everything. Wages have gone up. So if you own your practice and you are employing people, it costs more, right? The cost of business has gone up, but the amount that insurance companies reimburse healthcare providers has remained relatively flat. So, in order for doctors, dentists, nurse practitioners, physician assistants, healthcare facilities, in order for them to break even, let alone turn a profit, if the amount that they get paid remains the same, but the cost of doing business goes up, they got to see more people. We gave the example of a factory worker, and the factory worker comfortably can make 300 blocks. But then the employer says, I'm going to double your quota. You have to go from making 300 blocks to 600 blocks, but I'm not going to give you any extra time to do it. You still got to do it in that same amount of time. I'm not going to give you any new technology to help you do it. You got to do it with the same technology and equipment you have. I'm not going to hire extra people to help you do it. Oh, no, no. You just got to make it happen. So what happens is that there's a daily grind to see more and more and more and more patients. And that's why when you go, nobody's smiling at you because they're overwhelmed. That's why the doctor walks in looking distracted and hurried and rushed and disheveled. Because they are. They've been working all day. They worked through lunch. They didn't get to eat lunch, Gary. And Lord have mercy, if I miss lunch, no, they worked through lunch, Gary. Lunch started at 12. They saw their last patient at 12:50. And the next patient scheduled at 1. When they didn't eat. And if the doctor ain't eating, his medical assistant ain't eating because she got to help him. The nurse ain't eating. So yeah, the blood sugar low, they hungry, thirsty, dehydrated, worn out, tired, frustrated. Yeah. No, they ain't smiling. Fee for service. Fee for service. That leads to burnout. And we talked about this concept of burnout. Burnout is when you're overwhelmed, when you're stressed, when you don't have enough of the resources and support you need, and you're just exhausted. Burnout will turn your dream job into a nightmare. Burnout. Burnout can lead to depression and anxiety. And we talked about in the last episode how suicide is up in healthcare providers. Alcohol use disorder is up in healthcare providers. Substance use disorder, whether it be with controlled prescription drugs or even illicit drugs, is up in healthcare providers. Healthcare providers are leaving healthcare by the droves. They're retiring early, or they're not retiring, they just flat out quitting and going to do something else. All those years of training and education, all of that money. And they say, I just can't take it. If I'm going to keep living, I got to change what I'm doing. Some healthcare providers change at the model and they say, okay, I'm going to go do concierge medicine. I'm going to do VIP. And what that allows them to do is have smaller number of patients so that they can see a manageable number of patients per day and really spend the time with each patient the way they envisioned doing it when they went to health professions school. So that is the diagnosis. So what is the prescription, Hernando? I'm glad that you asked. It's not easy. The treatment won't be easy. It's like rooting out a malignancy. Malignancy is just a fancy word for cancer or tumor. It's not easy and it's not pleasant killing cancer, killing a tumor. It's not. Sometimes the treatment is just as bad as the disease. But you got to get through the treatment to get to the cure. And what we need is a revamp in our health care delivery system. Now, this is big stuff here I'm talking about, but this is treatment number one. We have to shift the way we pay healthcare providers. We have to change the way we pay healthcare facilities. We have to switch from quantity, i.e. volume, to quality, i.e. value, so that you get paid not for how many patients you see, but for how well you take care of those patients. Where you're incentivized to do a better job taking care of your patients, so that out of all your patients who have high blood pressure, the more of your patients that have normal blood pressure, the more money you make. Out of all of your patients who have diabetes, the better their blood sugar is controlled, the better you do financially. What percentage of your patients get their age and sex appropriate cancer screenings? The more of your patients who do that, the better you do financially. Value-based care, paying for quality over quantity, is one of the treatments for our healthcare system. Well, what's that going to do, Hernando? It will shift the focus from a fee-for-service, volume-based practice and force us to find ways to take better care of the same number of patients. It forces ingenuity, yes. Creativity, yes. But we can do it. We can create different delivery models of care. Yes, we can. How do you know, Hernando? Because we've done it before. We're doing it now. There are a bunch of companies out there, a bunch of organizations out there right now who are practicing value-based care now, where the doctors don't have 2,000 and 3,000 patients. They have 500, 600, 700, 800 patients, a lot more manageable. They're not seeing 25, 30, 40, 50 patients a day. They're seeing 8, 10, 12, 14 patients a day. They have same day access so that if you're sick, you don't have to go to the emergency room or go to urgent care. Hey, novel idea, you're sick, you can go see your doctor. It's happening now. So we got to change the way we pay healthcare providers, which would then force a change in how we deliver care. So we have to change from fee for service. Also, what has to happen, and this can happen right now, and it should, providers, doctors, nurse practitioners, physician assistants, dentists, optometrists, podiatrists, we have to do self-examination, self-assessment, and self-care. We have to learn about ourselves. What are our preferred communication styles? What's our personality type? And how does that communication style and how does that personality type affect my patients? Are there things I can do? Are there things that I can change about my communication style that would make it easier for me to connect with my patients? We got to do self-improvement. How do we get better? Are we surveying our patients in our practices and asking how their experience was? And then taking that feedback and using it to actually make changes in our practices and in our delivery of care? We can do that now. Providers and healthcare employers, we have to make wellness in healthcare workers a top priority. We have to address burnout. We have to address depression and anxiety and substance use. And we have to make resources available in a destigmatized fashion where people don't have to worry about losing their jobs or losing their license. They can just get the help they need with resources that are there, anonymous if need be. Because burnout is so rampant in healthcare that we can't quit our way or fire our way out of it. So we gotta make it a part of just how we engage one another in healthcare. And that's from the provider all the way to the front desk person. We got to have wellness programs. They can be company sponsored and provided. They can be state sponsored and provided, but we got to take care of our healthcare workers. And then we have to partner, public-private partnerships with organizations like Dr. Lorna Breen Heroes. Look up this foundation, the Dr. Lorna Breen Foundation. You can go to Dr. Lorna Breen, DrLornaBreen.org. Dr. Lorna Breen was an emergency medicine physician practicing emergency medicine during the height of the COVID pandemic. And Dr. Breen was battling depression. But Dr. Breen was afraid to seek help because at that time, every time you renewed your license, there were questions that asked about, had you been treated for depression? Had you had suicidal thoughts or anxiety or dealt with substance use problems? And if you checked yes, you could be at risk of your license being suspended, your ability to practice being restricted, even losing your license. So Dr. Breen and many like her suffered in silence until one day, Dr. Breen couldn't take it anymore. And she died by suicide. So there has been a movement all around this country led by organizations such as the Dr. Lorna Breen Heroes to change that license renewal and the licensing process for healthcare providers, to take that question away. But not only take that question away, but also create wellness programs all across this country where people who work in healthcare can get the help they need in an anonymous fashion, and many times for free. We have to take care of those who take care of others. So that's the hard work. But what are some easy things you do? Because now this treatment is easy. Do the small things. Hey, how about having available cold bottles of water for free in the waiting room while your patients wait? Heck, Keurigs don't even cost that much, and you can get a whole slew of K-Cups. How about some coffee while they wait or some healthy snacks? Just the small stuff. Hey, even if you don't want to do the coffee and the snacks and you just want to do the water, that's fine. Well, but what about providing some professional development for your staff? Because we've said that they don't teach us this stuff in health profession school about how to deliver good customer service, how to be pleasant. Sometimes we take for granted that people know, but sometimes you just got to show people. How about being more intentional with our patients in terms of our communication so that if there's a delay, we articulate that. Hey, the doctor's running behind. This is where you are. Giving them updates. How about asking them at the end of the visit, how was your visit today? Was there anything that we could do to make it a better visit next time? Being intentional. And then actually taking the feedback, taking it back to the team, and maybe modifying some things about how you do things. Hey, why not create a position? And you don't have to hire a new person, but why don't you label someone like the chairperson of patient experience? Make them the patient experience champion and make it their job to identify the root cause of what is making the patient experience a bad or less than desirable experience. And then incentivize your staff for improvement in the patient experience. Do re mi. How about because I hope you're bonusing your staff, but how about taking part of that bonus and disconnecting it from like just volume based stuff and that kind of performance and linking part of that bonus to improved patient experience numbers. So that if you ask your patients to survey you and you started out at 2 and 3 stars, but by Christmas time or by summertime, you're up to 4 or 5 stars, how about they get the other part of that bonus then? Intentionality, y'all. It won't get better if we don't make a conscious effort to try. And that's what it boils down to. Whether you do all of this stuff or just some of it, the purpose of this module was to plant a seed and get us to start thinking differently about the services we render, the care we provide to our patients, and stop looking at them as just somebody who's coming who wants something, and look at them as the person who, first of all, is bringing revenue to your job, who deserves respect and deserves a pleasant experience. And if we can do that, if we can be intentional about that, it's a win-win. Your job will be easier. Your day will be easier. Everybody will be happier. Your patients will enjoy coming to see you more. They'll be more likely to trust you and communicate openly with you and follow your communication and follow your recommendations, and their health will be better. And that's what we want. So this has been my pleasure. And this has been another episode of the Prescription for Better Living podcast. As always, I'm Dr. Hernando Carter. Yes, board certified internal medicine physician and your primary care extraordinaire, saying wherever you go, whatever you do, stand on the tallest mountain you can and scream to the top of your lungs, hallelujah, Dr. Carter is here. Until next time, Dr. Carter saying, peace out.